third example of using the ZeroG for other than stroke patients are individuals that have trunk control issues. Not only stroke patients have trunk control issues, patients with traumatic brain injury, possibly patients that have Parkinson's. There are many different diagnoses out there that impact a patient's trunk control. I'm going to explain 3 possible ways within the system that you could treat the trunk. There are probably many other ways that you could use a system in working with the trunk for patients. One is in standing. In standing, you could focus on arm movement with and without weights. You could focus on trunk rotation or using a TheraBand underneath a person's foot and then with your hand on the other end of the TheraBand, raising your arm vertically or in a diagonal. These are all different things that activate the trunk. Another way is in sitting. If a person is having a lot of trouble standing even in the ZeroG, but you're wanting to do something dynamically, you could have the person on a bench so that their back is unsupported. I would put them in the balance mode so that you can control the distance that the trolley will move. Remember those invisible walls? If a person is having a lot of trunk issues, you might only set it 6 inches so that after they go forward 6 inches, it stops them. As they go backwards 6 inches, it stops them. So they're really in a very controlled environment. As they progress and are having better control of their trunk, you can increase that trolley distance and having them practice more tasks. You can work on lower trunk initiated movements and upper trunk initiated movements in a seated position. A third way is sit to stand. I like sit to stand a lot because it works on many different things. I typically start with this as one of the first activities when I'm working with a patient. Sit to stand can work on symmetry in both legs. It can work with symmetry in weight bearing in both legs. It can work on performing a transitional movement, which is what sit to stand is. It can work on strengthening the legs, and it can also work on trunk control.